Anyway, to this now, could getting a COVID-19 jab become mandatory? The pros and cons are being discussed by the Ministerial Advisory Committee on COVID-19, and that's according to the reporting of the Sunday Times yesterday. Let's bring into this conversation then Professor Shabir Madhi, Director of the Vaccines and Infectious Diseases Analytical Research Unit at Wits University. Professor Madhi, thank you for joining me. So if we are talking about mandatory vaccination, from the get-go, that sounds a bit draconian. It doesn't sound like the kind of thing we do as a constitutional democracy with Section 12 and the rights entailed therein of the Constitution, the right to freedom, and security and bodily integrity, etc. But at the same time, we can't run away from the fact that it's almost imperative for as many of us as possible to get vaccinated. Where do you land on this debate?
So good morning. So certainly, I don't think that it's unlikely that South Africa will have a mandatory vaccination policy anytime soon, because even if government is wanting to adopt such a stance, in all likelihood it will be challenged at the level of the Constitutional Court for the reasons that you actually mentioned. But at the same time, as you correctly pointed out, the only way out of this pandemic, which is a sustainable intervention, is vaccination. And unless we get at least 80 to 90% of our adult population vaccinated, it's unlikely that we're going to be able to get back to a relatively normal lifestyle. So although mandatory vaccination might not be on the table at this point in time, I do believe that there are tools available to us to encourage people to be vaccinated, and that is by imposing restrictions on those individuals that choose not to be vaccinated, especially when there isn't a justified medical reason not to be vaccinated and when vaccines are actually available. And the type of restrictions that are being imposed in other countries, such as the United States, such as France, as an example, includes placing restrictions on people that are not vaccinated from accessing different types of facilities, including restaurants, as an example. In some scenarios, as an example for healthcare workers, I think it's ethical, in fact it's unethical for healthcare workers not to be vaccinated, because by not being vaccinated, in addition to putting their own lives at risk, unfortunately they also pose a substantial threat to the very individuals they are meant to be looking after. Because we do know that even though vaccines don't protect against infection, or rather don't protect as well against infection compared with how well it protects against severe disease, it still reduces the likelihood of someone transmitting the virus onwards to others by up to about 50%. So although mandatory vaccination is unlikely to become a national policy anytime soon, I do believe that we can actually work to encourage people to be vaccinated. But again, that is only possible if there is adequate supply of vaccine and access to vaccines are not an issue.
So wouldn't imposing restrictions on certain activities for people who choose not to get vaccinated, who don't have a medical reason for choosing not to get vaccinated, wouldn't that amount to the same thing as basically saying that it's mandatory for you to get vaccinated? Because from the conversations I've been having, for instance, with the young people, when it opened up for the over 18s, I had two university students that I was talking to. One of them is studying to be a teacher, and he was saying that, well, on paper you have a choice, but in reality you don't really have a choice because you could get restricted. So doesn't it amount to the same thing?
Sure, but it's a choice in life that we make every day of our lives. If people want to drive a car, they need to get a license. If they want to drive a car without a license, there's consequences. They can end up in jail. And there's a number of other examples which I'm not going to cite. So rights are not absolute. Rights are within the limits of the law and within the interest of the public good as well. So yes, there are going to be restrictions that should be imposed on people that choose not to be vaccinated, but those are consequences that comes with making a poor decision.
And again, I suppose, let me ask you about what employers, for example, what kind of thinking should be going in preparation for this, for employers? What do you do? What employment policies do you put in place that will help you meet your demands for keeping and ensuring a safe working environment for everyone, which are statutory demands, but at the same time without forcing people to get vaccinated?
Yeah, absolutely. And I find it surprising that the trade unions, who are always promoting a safe work environment, are all of a sudden suggesting that they're going to take the case of mandatory vaccination to court. I find it mind-boggling that trade unions, whose interest should be the health of their members in the workspace, don't understand the need for people to be vaccinated so they don't pose a risk to others, in addition to actually deriving direct benefit. So certainly employers can make it a condition that if people choose not to be vaccinated, as an example, similar to what's happening at the moment where they have different types of screening, what should happen in the future is that those individuals that choose not to be vaccinated, they can still be accommodated in the workspace, but at their own expense, they should then provide evidence that they're actually not infected with the virus every 3 to 5 days, in addition to which they shouldn't be allowed to go to the common areas, such as having spaces where people have tea. They shouldn't be allowed to engage in any sort of gatherings where other people that are vaccinated won't be wearing a face mask. So restrictions will need to be imposed on those individuals that choose not to be vaccinated, even in the workspace. And I think it's in the interest of all workers to ensure that their fellow colleagues are actually vaccinated, because amongst those that are vaccinated, unfortunately, there are few that won't derive optimal protection from the vaccine because of underlying medical condition. And those that remain unvaccinated pose a threat to those individuals that did a responsible thing, got vaccinated, but still are not fully protected because of some medical condition, as an example.
So not much time has passed since we started on this path of saying all over 18s will get registered and get vaccinated. And I know that that has been a position of many in your field. And I suppose, if I'm not mistaken, including yourself, to say make the vaccine available for whomever wants it, who is eligible to be vaccinated. What is your sense of whether or not this will re-energize our vaccination drive? We're coming from a point where we had sort of dipped to just under the 200,000 per day doses administered. And I think in the last count, we were well over 200,000, 240,000 thereabout, not close to the 300,000 doses a day that we are targeting as per the President's directive. But do you believe that adding and actually opening it up and saying, if you are over 18, register and get vaccinated, will re-energize? Are we starting to see evidence of that?
Well, it will increase our numbers, but this is more than just a number game. I think we need to guard against just measuring the number of new people that are vaccinated each day. In the immediate future, the most important benefit of vaccine is protecting against severe disease and death. And for us to be able to do that, we need to ensure that we've got high levels of penetration in people above the age of 60, people above the age of 35 with underlying medical conditions. If we only got 50 to 60% protection in those individuals, and we got 90% protection in the 18 to 35-year age group, who are not at substantial risk of developing severe disease, unfortunately, we're not going to derive the full benefits of vaccination. So we need to have government now starting to report at a more granular level on the percentage of the population that's been vaccinated in different age groups, to get a good understanding as to where we stand when we experience a resurgence probably later this year, early next year. But it's more than just about the numbers that are vaccinated. Equally important is ensuring that those that are at high risk of ending up in hospital are actually being vaccinated in large numbers.
All right, Professor Shabir Madhi, I've got to thank you for your time and your insights there. He's Professor Shabir Madhi from Wits University, a vaccinologist, talking to us about these ongoing debates about what to do to ensure that as many of us as possible get vaccinated. You're watching